Today, I'm going to talk about one of the rare conditions called a bicornuate uterus. It is very rare. It is a birth defect, a developmental arrest that happens when you are inside your mother's womb. When you are in your mother's tummy, your organs are forming, especially your reproductive system, the organs that will later be important for menstruation, conception, and giving birth. In the beginning, the uterus does not start as one single structure. It actually develops as two separate tubes. As development progresses, these two tubes come together. They unite and form one single uterus. When you are born, we may not immediately know whether the uterus and the fallopian tubes are fully and normally formed. Most of the time, this becomes clearer after you attain puberty. Structurally, the uterus remains the same as it was formed during development, but it grows in size as you grow. However, if there was any developmental arrest during that early stage, that structural difference will remain unchanged. In some patients, there may be two uteruses, two fallopian tubes, two vaginal cavities, and two cervices at the same time. In a bicornuate uterus, the uterine cavities are only partially fused. A central wall remains, extending from top to bottom. That wall may be full length, half length, or even shorter. You might hear terms such as bicornuate uterus with a septum, deep septum, or complete septum. In general, when you see a bicornuate uterus, it is divided into two parts by a central wall, and that is why it is called a bicornuate uterus. It can be corrected relatively easily. In some cases of a bicornuate uterus, implantation may fail because the blood supply to the septum is poor. When the embryo implants on that septum, the inadequate blood flow can interfere with proper nourishment, and this can lead to complications. Many times, women may not even realize they have this condition until the time of delivery. Some may go through pregnancy and deliver normally without any difficulty. Quite often, it is discovered only after recurrent miscarriages or repeated pregnancy losses. In such situations, we perform an X-ray or an ultrasound examination, and that is when a bicornuate uterus is diagnosed. In IVF cases, we commonly perform an HSG, hysterosalpingography, which is a diagnostic X-ray used to check the patency of the fallopian tubes. During this procedure, we can also assess the shape of the uterine cavity. It can reveal whether the cavity is single, double, completely divided, or partially divided. All these structural details can be identified through HSG. It is routinely done as part of fertility evaluation and treatment. In some cases, hysteroscopy is also performed to confirm the diagnosis. Once the diagnosis is confirmed, corrective surgery can be performed. The procedure aims to remove the septum and restore a single, unified uterine cavity. After correction, the septum does not grow back because it is a one-time structural defect. Once it is surgically corrected, it is corrected permanently. Following surgery, you can go on to have a normal pregnancy and a normal delivery. However, in some cases, after surgery, additional support may be needed during pregnancy. A stitch, known as a cervical cerclage, may be placed to help prevent preterm labor and to support the pregnancy until term. Thank you for watching.